Hi, my name is Marissa Parker, and I did my poster presentation on adolescent obesity in the United States as a function of race, gender, and socioeconomic status. Obesity is a public health problem that affects people in all age groups. However, for adolescents defined as those between 12 and 18 years of age, it is a particularly important issue. Adolescence is a crucial period for establishing healthy behaviors that carry on into adulthood. Also, as teens undergo physical development, obesity causes lasting health effects often associated with old age, including diabetes, heart disease, high blood pressure, and cancer. For example, one study showed that 17.5% of U.S. adolescents are clinically obese and that 85% of those are obese adults 2 decades later. The purpose of this presentation is to identify the prevalence of adolescent obesity among the diverse population of the United States. The research problem and purpose. The research problem is identifying and quantifying the prevalence of obesity among the U.S. adolescents and to determine differences by race, gender, and socioeconomic status. This is a chart that determines if you are underweight, healthy, overweight, or obese. This is determined by your height and your weight. A structured approach was used to select the articles for review. Information and data about the rates of obesity in adolescents, as well as population prevalence, was derived for peer-reviewed literature gathered from an online search of Galilean databases in the area of health sciences and medicine. Suggested research design and suggested sample. Representative sample N equals 26,690 adolescents in the United States, age 12 to 19, taken from various cross-sections of the National Health and Nutritional Examination Survey. Subgroups include regional areas of the United States, race, gender, and socioeconomic status. Hypothesized limitations included large numbers of clinicians who, it was found, do not routinely administer BMI testing to adolescent patients. Also, there is a problem in that many of the subgroups studied did not participate in or otherwise access in the healthcare system. This may result in skewing of the numbers among these groups. This is a picture that says 1/3 of children in the United States are overweight or obese. Variables. Independent variables in this study are caloric intake, exercise and other activities, race, gender, and socioeconomic status. The dependent variables is obesity, as determined by the BMI measurement. Measurements. Body mass index, as used by the research cited, is a measurement related to height. The formula is weight divided by height multiplied by 703. Obesity is defined in the United States as BMI in the 95th percentile or higher for sex and age. Note this number may vary in other countries. In the most widely cited analyzed, Skinner and Shelton analyzed data from between the year of 1999 to 2012 in a total of 26,690 adolescents. The data was derived from the National Health and Nutritional Examination Survey by the NIH. BMI prevalence was found to increase accordingly to certain subgroups, including African Americans, males, and adolescents of lower socioeconomic status. The literature review. Obesity has consistently been shown to have harmful effects on the health of adolescents and causes problems which affect the whole lifespan of the individual. This is especially true in the United States, where researchers have found diseases associated with older adults been formed during the adolescent years. For example, fat formed in the body during the teenage years not only stays in the body but causes raised lesions and clavication in the aorta and coronary arteries in adults. For adolescents between the ages of 12 and 18, obesity is defined as having a body mass index over 95th percentile. It was determined that body mass index comparison charts were useful tools to identify adolescents but were utilized by clinicians. Despite this, Skinner utilized BMI data to determine that between 16% and 18% of the U.S. adolescents are obese. Furthermore, it has been found that obesity in the United States is of higher prevalence in some other than others. Boys are more likely to be obese than girls. This is especially true in the case of African Americans, In addition, Hispanics, African Americans, and Native Americans suffer from higher obesity than whites. Economic status also plays a significant role in that lower status is associated with higher prevalence. Thank you.